So if I were you and I just finished my deep cleaning, this is the exact routine that I would recommend to my patients. First things first, you're going to want to get a toothpaste that's going to be targeting active gum repair or bleeding. So let me just show you two brands that I would steer towards. So Parodontax has an active gum repair, and they also have this one here that it's an anti-cavity, anti-gingivitis. Crest also has a gum detoxify that helps kill bacteria and stop bleeding gums. The other thing that you're going to want to get is a mouthwash. So let me show you the two that I would recommend, because I normally also lean towards closest, but I'm not seeing that here. Parodontax, and you're going to see that on the back. And Crest also has the gum detoxify. Same ingredient, so whatever you prefer. The other thing that I'd highly recommend is a water pick. They only have one here at Target, but you can get the advanced water pick that's handheld, which I recommend. So let me show you the one, unless you'd like it like on a stand. You can get the water pick or any type of water flosser. This one's nice because the reservoir is pretty large, so meaning you're not having to consistently refill the water. I'd recommend 50% water, 50% your mouthwash that you're going to use, whether that's gum detoxify or the Parodontax. And you can see here it's a pretty large reservoir, and it comes with different tips. I just noticed that Quip has a water flosser as well, and their reservoir is actually pretty nice and large, which I like. I only think they have, actually, hold on. This is actually pretty nice. Price point, it seems like it's $73. It's a couple dollars less. And the water reservoir is pretty cool too. And it has like a nice little quick little charging port there. Same type of deal. You're going to use this twice a day, 50% water, 50% your choice of mouthwash. Aim it at the gum tissue. The other thing is you're going to want to get an electric toothbrush. My choice is Oral-B. I personally like this one. This is the one that I use at home. Price point, you'll probably get this a little bit cheaper at get a coupon or something like that at other locations. But it does have a gum care setting, which I absolutely love. And you want to change this tip every 3 months. If you're not an Oral-B girly or guy, you can try other ones. Let me show you. Sonicare, I don't like their head, because if you look at the difference between the head of a Sonicare and the head of an Oral-B, this kind of gets at the gum line, and it is basically contoured towards the tissue, which I really like. If you're not looking to spend as much on a toothbrush, you could do this Oral-B, but the oscillating system on this is not as good as obviously the higher price point one. And then lastly, you're going to want to get a soft pick. Soft pick, especially for patients that have bone loss. You're going to get food trapped near the gum line. You're going to want to get these and stick them in your purse or your car. Grin has a really nice soft pick, which I really like. The handle's really long, but Gum also makes a really nice one as well. So you can see there. Now, don't get it confused with interdental brushes. Target also has a soft pick, which you can do. I think it's a little bit cheaper, a couple cents. These interdental brushes I would use very carefully in between your teeth, because they're an actual brush with a wire. And if you use too aggressively, you can actually damage your tissue. So I would stay away from those if you can and stick to the softer ones. And if you're not a flosser, I don't care. I still want you using the water pick twice a day. You're gonna want to get some type of floss, whether that is, floss picks or regular floss, and do that also twice a day. You kind of want to be aggressive because the bacteria is aggressive, hence the reasoning why we want to see you every 3 months.